Karibu sana. It's another episode that we are going to learn, engage. I want your comments, your feedbacks on your opinion about this. I would call today's shows, the cost of ignorance or the cost of unpreparedness. So kindly let's talk. This is your Nurse Companion show where we talk all things health, people who have gone different journey health that are going to tell us. You're going to have different doctors, different nurses, different consultants giving us their opinion on different health journeys. So I am your host, Caroline Wanjiru Mwangi, ready to share this space as we learn, as we engage. So today's show we are going to talk about more of preconception care. And if you go to our pages or our handles, there's a story about Stacy that was talked on the Devolution Summit. Ilikuwa Devolution Summit where different governors and politicians were gathered, and she shared her story on how she went to the hospital and some of the services that she wanted were delayed. And at the end of the story, tunakuta mahali, she had to lose her uterus. Something that she went on hospital on time, something that it costs people's life. To some, wameingia hiyo hospitali na wametoka bila watoto, which is a very sad story. So I want us to talk about preparedness and the cost of ignorance. For Stacy, it was ignorance more of lack of personnel, and the emergency strategy on kutoka ambiwa anataka kwenda theater to the time she actually got to theater. So before putting some light on that story about Stacy, let us go back to preparedness. So I stay in Mwea in Kirinyaga County, and right now in Mwea is the planting season. Kabla upande mchele, there's so much preparedness that takes place. Unakuta wengine they have to do all the farms who have to do the small garden first, na put the seedlings stay there, they grow, and they will transfer now to the mainland. And you see a lot of people in Mwea right now, they are busy making sure they have the right fertilizer. They consult, some go ahead and consult the agronomist. Wengine wanaenda na consult jirani mwenye alikuwa na mavuno mzuri last season, ulifanya nini mzuri for me to get a better yield, for me to get better results. And that's farming here in Mwea, and it happens to everywhere in Kenya. Is it Kitale where we deal with maize? Unakuta people have to prepare the kind of seed that you're giving in, the kind of fertilizer, the kind of personnel you need to do. Alafu, the more you do it, the more you get the skills, and the more you teach others. So is our health. As a midwife, I want just to put some light. As much as we want to have babies, and as much as we have gotten married, we are settled down, and now the next thing is babies. Because even when we are getting married, the next thing is having children. How much time do we take to prepare ourselves? As we said in the farm, they are taking care of the land, taking care of the seed, right? In the human perspective, I would say the uterus or the woman is the land part of it, because she's the one who is going to carry it at the 9 months. And mara mingi unakuta wanawake ni wanapewa that priority of going to the clinics. They go to the clinics, immediately they get pregnant, they get checkups. All these things, making sure that the seed that is growing gets to term, and she delivers a healthy baby. And of course, the goal of every mom is a healthy baby and a healthy mom. So what about preconception care? Because in statistics we see like 39% there is so much ignorance in preconception care. And what is preconception care? Let me say, what is preconception care? This is every health initiative that is given to a couple before conceiving. Can be 3 to 6 months before conception. And why is it necessary? We have seen different people wakiwa on a different condition. We have diabetes, we have hypertension, and all those things that recur to the next pregnancy. So as a man atauliza, why do I need the preconception care? I think only my wife needs it. But what about the seed that you're bringing forth? Man, whatever you give to a woman, it's what she carries to term. So what's the care that is needed in your seed that you're giving to a woman to carry the 9 months? There are several things that will affect you as a man, that will affect the seed you carry and what you bring forth. Unajua kuna mtu anasemanga huyu mtoto maybe anakaa kama babake, which is true in a perspective because the seed is from the man. So the way you take care of yourself as a man, alcohol will affect your sperm count. The kind of the cigarette smoking shall affect. The lifestyle itself as a man will affect the kind of seed that you're giving to the woman. So before we get to the station of where we check how the woman is, how is her BP, how are her sugars, we need to first check about the man. So I'm just putting some essence and some clearance that every man needs to have the care, just like every woman needs it. So that is preconception care. That's why we come discuss. Are you having any conditions? Are you having any diabetes? Are you obese? Do you want to reduce on your weight? This is how you have one-on-one conversation. And what are your expectations? When do you want to carry this pregnancy from this time to this time? Do you imagine if you all planned or we went for preconception care, how beautiful families would be? Hakuna mtu angekuwa anasema ulikuwa nataka mtoto, mimi sikuwa nataka mtoto, because you sat down, discussed it, and then as a family, you involved a health worker who tells you this is the way to go. These are the things that would affect fertilization. Because do you know that the state of a sperm would cause a miscarriage or an abortion? Do you know that? So as much as the woman would be told that she carries and maybe the pregnancy did not get to term, what about the state of the seed that you're bringing forth? The seed that you're bringing out to a woman, how is the state of it? So for me, as a man, as a lady, or as a nurse, I would incorporate, if you're planning to have a child, these are the things that I need, because there is a lot of lifestyle changes that is needed. So that is preconception care. And then there was a statistic that was done, a research done by WHO, that is the World Health Organization, that says that taking calcium to women who had like preeclampsia. Preeclampsia is where she had high blood pressure during a pregnancy. That if she started taking the calcium before conceiving now the second child, she is going to reduce the chances of the recurrence of the hypertension. There's most of the things that we are undergoing even in the second pregnancy that can be diagnosed early, treated early. So when you're getting pregnant, you don't have to go through the same condition that you went through the first pregnancy. So in the research says that calcium, taking calcium early, taking the folic acid early will help you protect yourself from the recurrent of the same condition in the next pregnancy. So to every woman starting the antenatal clinics, zile clinics zetu tunaendanga tukiwa na tukishashika mimba. Now most of the time most of them would say I would prefer nianze clinic after nimeanza nausea and vomiting zimeisha. That is, to most women, hapo itakuwa after the first trimester. The first trimester from the 1 month to the 3rd month, nipo nakuta mtu ako na nausea, you're feeling tired, you're feeling worn out, you don't want anything, you're feeling so tired. So many ladies will choose not to start the supplements or to go to the clinic until he knows wacha isha kwanza ndivyo niende hospitali. Wacha niache kusikia venye nasikia kwanza ndivyo niende. Whereas the 1 to the 3rd month, the 1st to the 3rd month is where your child or the growing baby needs those supplements rather than hizo kuanzia ati after nausea imeisha from maybe the 2nd trimester. So this is a clarion call for every woman. Either you have tested today. If you are planning to get pregnant, go earlier, 3 months to 6 months earlier to the hospital. Talk to a to a nurse or a midwife or a gyna that I would want to get pregnant this and this time. So what advice would you give me that I may have better care or better progress? Most of the people who are going to to see the gynecologist, or many people who are going to get the preconception care, are mostly those who have had a condition in their past pregnancy. Maybe it was a pregnancy loss, or maybe they had fibroids, or they had something that caused them. Now the next pregnancy, they are seeking help. You can seek help even when you're healthy. You can seek help when you're just planning to get pregnant. As early as now, I want in the next 6 months to get pregnant, let me seek help. Let me start giving the body the right nutrients that is needed. Let me give the right lifestyle to bring forth, as a man, to bring forth the right seed and a healthy seed. Because you have seen men having issues with like sperm counts. And of course, sperm count will affect the fertilization period. So having someone who is working with you this journey before and then immediately after conception, you have already started taking the supplements. Okay, to someone who did not go for the preconception care, amejua leo now she's pregnant, what time do you think is good enough for you to start taking the supplements? Is immediately that you have known you're pregnant. Like immediately, nimekapima kameenda positive, immediately now start taking the supplements that are needed in pregnancy. Why? As we have said, the first month, the third month is where you are forming the baby. It's just the baby is forming, the bone is forming, the brain is forming, the heart is forming, everything is forming in the first to the third month. It is not evident in your belly, the belly is still flat, but whatever that is happening behind the scenes is so much bigger because the brain is forming, the heart is, those important organs are forming. And from the first month to the third month is where we need all the necessary nutrition. As you have said, if you went to the preconception care in pregnancy, there are some of the things that the doctor is going to test. One, blood pressure yako iko aje. Secondly, what is your blood group? Thirdly, what is your HB level? HB level ni kiwango ya damu mwilini, inatoshana aje. The hemoglobin level yenye inabeba oxygen. So inatoshana aje kwa mwili. So if all these things were detected earlier before you got pregnant, zitakuwa zimeangaliwa na daktari. Umepewa the right nutrients, the right supplements, you are taking the right treatment, and now when the baby is here, the body can easily adjust. Because if you have a low HB and now you are getting pregnant, of course it will bring a toll on you. You'll get tired, you'll start having the dizziness, some go ahead even start fainting. So if you had a blood pressure before getting pregnant and now you are pregnant, of course the body still have reactions. But if you had walked that journey and now you are going from preconception to now conception, now you know the changes, you have been taught, you are ready enough. Okay, so tumetoka preconception, tumeanza clinic, tumesema immediately you know you're pregnant, you need to take the supplement. So you need to go to the hospital immediately. Don't say, let me just wait for the nausea to ishe kwanza, let me wacha kakue at least nione kona evidence. No, just start immediately. Go start, because the WHO right now is recommending 8 contacts. Like unafaa kuwa umemeet nurse wako ama midwife wako ama gyno wako during the pregnancy 8 times. So you can imagine how many times you have just gone, have your weight done, have your BP checkup, and walking this journey with you. And should men go to these clinics? Yes, of course. Because imagine being told you need this and this and these things. So when the husband is there, of course there's the moral support. He is knowledgeable. He knows what he expects. He's getting the knowledge. At least you know you're walking this journey together. I want us to talk about the delays that have been there. The delays that have been there in seeking help or in going to hospital. The first delay is decision making. Decision making in the small decision like that one. When should I go? When should I start my antenatal clinic? Nitafaa kuzianza lini? Kuna mwingine atasema kama wewe anasema, mwingine atasema after the nausea is done. Is it right? No, it's not. So decision making, if it's hard for you, kindly consult a medical profession. Consult your midwife. Consult the gyne. When should I start? What do you think about this and this? Do not assume or go consult someone else, whereas they did not walk the journey with you or the journey that you're walking in. Because if you have hypertension and you're going consulting someone who has no issue with hypertension or diabetes, they're going to give you the wrong information. So just knowing that you have a different journey from another person, took on a different journeys of life. Another thing, the second delay is delay to seek help, like medical help. Like today I had a call, I know maybe the person will hear this. I had a call, someone telling me, I am 20 weeks, 22 weeks, and I'm bleeding. I've been bleeding for the last 3 days. It was minimal. Ananiambia, ilikuwa kidogo, lakini kuanzia jana usiku imekuwa mingi. And my worry is, okay, as much as there's delay in decision making, the second delay is delay in seeking help. Why did you just not go? Because bleeding in 22 weeks is not right. As long as you conceived, maybe the first few days, you will have some little spotting, which is the implantation. Ile time yenye mtoto ana implant kwa uterus, you will have some spotting, little spotting. But 22 weeks, we are not expecting our period. So why are you bleeding at home and not going to hospital? Just go ask. Just go get a checkup. You just go get a checkup. Maybe uambiwe, it is not needed, everything is okay, the baby is okay, why are we bleeding at 22 weeks? These are the things that we need to get to hospital early enough. Because it's 22 weeks, why are you not going to hospital? So seeking the medical services early is a good thing that is going to protect us from a lot of damages, because maybe that's a pregnancy that would have been saved if they went early. So seek medical care early enough. Then the other delay is even delay of getting to the hospital. This, even when you are going to antenatal clinic, the first thing that the doctor would want you to make, or the nurse would want you to make, is a birth plan. In the birth plan, it talks about who will accompany you, how have you packed yourself, how have you prepared yourself financially, who is going to accompany you to hospital, how are you going to get to the hospital, like which mode of transport getting to the hospital. Because kuna mwingine mahali yako na mahali anaenda hospitalini. You know, right now I'm at least in Kirinyaga County. I'm not talking to like high-end people who are going to Nairobi Hospital and all those hospitals. I am talking about the situation yenye iko hapa kwa ground. Kabla utoke mahali ndani, ufike facility yenye unaenda, utafika aje? What if the labor pains came at night? What if the emergency came at night? How do you access hospital? And then in the case of, like we saw, Tracy got to hospital early, but the availability of the ambulance. I'm going to look for a SHA person who is going to give us on hospitals maybe around here, or which hospitals are they using the SHA? Because as a person, as you subscribe to that SHA, you need to know which hospital can I access, what services are they giving. Like a woman, as a woman, they have an ambulance. Is it secondly? Do they have a theater? Because let's say you had a previous scar, like that is a CS, ulikuwa umeenda CS the first pregnancy. Why are you going to a health center in the next pregnancy, where else the likelihood of having a CS is like 80%? Like the likelihood of having the second CS is it's higher than a person who did not have a previous CS. I hope unanishika. Like, these are the things that when you're walking to the antenatal clinic, as you're planning with your spouse or your caregivers, when you're attending a hospitalini, analyze all this situation at hand. How do I get to hospital? What of services are this hospital offering? Much as you have chosen maybe a hospitali imeanza hapo karibu na household yenyu na umeona ni hospitali rembo, kindly inquire, do they have an ambulance? Na kama hawana ambulance, ile time kuna emergency, what do they do? Do they have a theater? Because you're going to delay services for your own good. So even if you have a SHA, kindly know this hospital naenda hiyo SHA inalipa nini na nini. Because availability of the transport, delay ya kufika hospitalini na delay ya kupewa services. Like for the story of Stacy, yake ilikuwa delay ya kupewa services. She made the right decision. Let me go to hospital on time. She got there in time, so she did not delay on transport to the hospital. Her delay came in services. That is beyond now the client, because it's about the governance, it's about the availability of staffing, some things that are bigger, maybe bigger than us, that needs to be given so much light. The health sector needs a lot of light, because we have lost so many mothers. We have lost so many children because of something that is an ignorance, because at the end of the day, an ambulance needs to have fuel. Like in the case of Stacy, why was an ambulance not having fuel? Someone just ignored us, so it wasn't good enough. Ama alipouza tu. So let me just close on that. But as I was saying, let's make sure, as much as you're walking this journey, the 3 delays, hakuna delay ya kujua, this is a decision, I need to go to hospital. How do I go to hospital? And now that hospital, will I get the services that I need? Kindly comment. I know as much as we have different ideas, and of course the nurse is muchly blamed, we all take the blame in such a case of umekosa kuenda hospitalini. Now when you're going when it's too late. Ignorance of the fact that ulikuwa unajua maybe like kama you are bleeding, you are bleeding, why ignore seeking help? I wouldn't know, just let me know. I want to put a story of who, I guess she should be the topic, who killed Sarah? Who killed Sarah? There's such a movie, right? So, who killed Sarah? So, let's put it. Sarah is a 24-year-old who, of course, she's married, she's pregnant, now 24 weeks pregnant, or let's say 22 weeks like the one who just called me, but I hope that shall not be the situation for the one who called me. So 22 weeks old pregnancy, she started bleeding, and of course it's like maybe ni bleeding too. So she ignores a bleeding. So the next day after the husband gets to work, of course lazima ngoje habi atoke job jioni, niambia bleeding imeongezeka sana, I'm having dizziness, let's go to the hospital. So they start looking for a nearby taxi or a bodaboda to get to someone who knows Moya, sema yako Kiumbu, and now they are going to seek help. They go to the health center, and the bleeding is just too much. They're trying to arrest it. Of course, an ambulance is called all the way, goes, seeks help now to the larger hospital. When they get there, of course, blood, they're looking for blood. She's started now to convulse, anakimbishwa, much help is needed. The consultants are called, all those things. But at the end of the day, we lose Sarah because she has lost a lot of blood. As much as it was transfused, alipoongezewa damu zingine maybe 4-5, we still lost her. So who killed Sarah is just a story to show how it takes a community, a whole community, or us, all of us, to get involved in the health. Of course, the first thing would be, kwani alifika hospitali na kuangaliwa vizuri? Yeah, but I want to show the essence of how being alert as an individual, as a facility, as a nurse, as a mother will protect us from having more death. Because Sarah was a wife, Sarah was a mother to another child. We just lost her because of a little pregnancy that she started now bleeding, and bleeding got out of the way. It was so much, and we later lost her despite all the intervention given. So let's break it down. Tulisema preconception care. Preconception care, Sarah would have already started clinic. By 22 weeks already alikuwa shafaa kuwa umeanza clinic. And if you're watching me na ujaanza clinic, kindly start your clinics and start it early. If you know of a friend who has not started clinic, ati anangojea maybe afike for 12 weeks, kindly tell the person, as much as you've gotten pregnant, immediately you've just tested, you are pregnant, start the clinic early, immediately. And if you know of a friend who is planning to get pregnant, or you are planning to get pregnant, as a man, kindly, if you're planning, start the care early. Seek help early. They say prevention is better than cure. Because in the case of Sarah, one, she at 22 weeks, anafaa kuwa ameanza clinic. In the clinic, anafaa kuwa ameanza supplements. In the clinic, you ask questions like, when should I bleed or should I not bleed? You are taught on the danger signs. Because only bleeding is not the only danger sign. Kuna wengine unakuta waanza kufura uso. Anafura, inaenda kwa uso, inaanza kuenda kwa miguu, inaenda, akifika kwenda hospitalini, it's already too late. It's already too late. So it's not just bleeding. Having high blood pressure. How do you know you have high blood pressure? Where else kwa nyumbani na ujaenda kwanza clinic? Because the first thing utaanza kusikia ni dizziness. And the next thing you're falling and you're convulsing. So already shaanza kutoka the normal BP, we are getting to preeclampsia where it is having other issues. Inaanza kuongezeka. Seek help early. The third thing that another delay that we see in Sarah, not just making the decision early, but seeking help early. Why, start spotting today, sleep and wait for the next day. You sleep, wait for the whole day. We are waiting for the husband to come home in the evening so that atupeleke hospitali. All right, it's also a decision. But would we have prevented the death if we went early? Because if we went early, maybe ungefika hospitalini. It don't be an emergency as such, because maybe ungefika hospitalini, have an ultrasound. Maybe we even have saved not just the mother, but the little baby, the infant. No, not the infant, the implanted already baby. So seeking, I'm just putting the clarity on seeking help early. So another delay is Sarah gets to the hospital, but wherever she starts in is a place that did not have a holistic care, maybe did not have a theater, did not have a ready surgeon, a doctor who are there ready, or already receiving emergency team. That's another delay. Where else, okay, in the health sector, health centers, there are helps, but say the help early would have saved. Sarah gets to hospital, the bleeding is just, and we lose her because of bleeding, and she has been given a lot of transfusions. Another gap that has been there, you can transfusions, but because of the loss of blood, we had already had, alikuwa shaanza kupata organ failure. Organ failure ilitoka tu, kale ka bleeding kalianza siku moja, kakapuuzwa, kameenda siku mbili, kamepelekwa health center imeenda another hospital. Tao tukifika kuanza kutransfuse, tulikuwa tushaanza kupata organ failure na ameanza kuwa unconscious to something bigger and bigger that we need either an ICU or maybe organ failure, and we even lose the mother, because these are situations that kwa ground ziko. So in the story of Stacy, which you will see, there's a previous video on the devolution on Stacy, she was able to from the bleeding, but what could not be saved anymore was the uterus. There was a delay in the services that were given. Akakuwa na bleeding, na ukisikia mahali even the uterus is being removed, trust you me, it was a mass bleeding. So yes, they were able to save the mother, but the uterus could not be saved. Something like in the story of Sarah could have been saved if she sought help early. So yes, I know we do have a lot of blame on the nurses and the doctors when they are giving care. I am not saying we don't have ignorance in services. Yes, there is. But there are sometimes is our role that we have ignored or tukapuuza ina imetufikisha hapa tulipo. Because if you haven't, kindly seek knowledge about pregnancy. Ask a health worker, when should I do this? How do I do it? Can prevent you from something bigger like a maternal death. It takes the whole community to reduce these numbers of maternal death. It takes the community to reduce the number of children born with birth defects. It takes the whole community to reduce the number of neonatal deaths. Because if you are all intentional, what kind of lifestyle am I having before conceiving as a mom or as a father, we are going to bring forth a healthy baby. We are going to bring forth a healthy pregnancy. So why is it important? Someone will say, just tell us, give us a doctor who is going to tell us about hypertension. But do you know some of these conditions just started from something as early as conception? It did not start when you were giving birth. It did not start when you started schooling. It started from the conception. So can we give some more light on the conception period? Can we give some more light on the pregnancy? Yes, I know I'm going to bring different consultants. I'm going to bring different medical practitioners, but I want to still insist on it starts behind the scenes where no one is seeing the little one that is growing. It is started way beyond the lifestyle that you had before conception. And then how did you carry the pregnancy? How was the love? How was it? How was your growth? And then now to bringing forth a healthy baby, seeking the health services early, going to hospital early, visiting the clinics early, and you're going to bring forth a healthy, bouncing baby girl and bouncing baby boy. So I am your nurse companion. I would want to know why I would want to know, is it lack of information or is it ignorance? Because if we would put emphasis on our health or the care of our health as we put in our lands, kusana sana mwea, if we put the kind of care on our health and the pregnancy and the journey of different health journey you are in. As you put in your land, you make sure you have the right fertilizers, you make sure you have the right seeds, all these things. If you would put the same energy, I'm sure we'd have a beautiful, beautiful community, because everyone should be very intentional. So that's all for today. My point was, now see the cost of ignorance, see the cost of unpreparedness. And I pray we are not going to lose any mother, any child, because of cost of ignorance. So let's walk this journey together. I am your host, Caroline Wanjiru Mwangi. This show airs in every social handles. In LinkedIn, we are on YouTube, we are on Facebook, we are on X. So kindly share your opinion. And we always live at Oasis TV, where I bring all information about health, and I'm so excited to walk this journey with you. So that's all for today. Bye.